Welcome in the Poznań Pediatric Orthopedic and Traumatology Department, which is located in the Victor Dega Hospital. It is a university hospital dealing with the general orthopedic and rehabilitation. But our department is especially specialized in the treatment of the pediatric disorders, mainly the congenital disorders, the spine deformities, the neurogenic disorders, and of course the trauma. So the good surgery table is very important for us. The table must be as good as the surgeon wants. In comparison to the past, when we haven't got any good equipment in Poland at all, and at this hospital also, our only one requirement was the height of the table, nothing more, because nothing more was possible. And then suddenly, about 1 year ago, we saw the new high-tech and very modern tables like your unit tables, with many of options to operate them. So it improved our comfort of our life, of our work during our surgeries. The type of the procedures have any special requirements to the positioning of the patient. So then all the equipment, the stability of the tables, the radiolucency of that, the operating, the changing the position of the table, it's very important for us. So of course, as a surgeons, we are focused on the surgery place, on the very small room of the approach, of the surgery approach. But the positioning of the patients make us easier to see inside, to operate, to make the procedures. There is a full radiolucent table with no any problems, with no any elements seen on the screen during the C-arm control. The majority of the surgery is done on the spine and on the lower legs. So it means that the positioning, especially to the approach for the pelvis, for the hip joint, are very, very important. It is a little bit easier to position for the foot surgery, patient for the foot surgery, but for the knee joint, hip joint, and the spine, the positioning of the patient on the table must be stable and must be changeable during the surgery. Of course, it is possible to get with using the Maquet Yuno, and my experience from the past was very, very bad, and it was very, very difficult to achieve that without this kind of the table designs. If we are walking in better situation, we are less tired after the surgery or during the surgery, it means that the quality must influence the status of our patients. And as I told before, I am the pediatric orthopedic surgeon. So it means that the quality of their life in the future, after achieving their adulthood, it's partially dependent on the environment and we are working in. So this is a relation. It's difficult to say how much, but it is.